Hello, everyone, and welcome to More Than a Patient, Navigating Care, Medical Trauma, and Identity with Chronic Health Conditions. I go by Dr. Mars. I work as a clinical psychologist at Brown University Health, and I am a clinical instructor at Alpert Medical School of Brown University within the Department of Psychiatry and Human Behavior. I'm also on the International Consortium for EDS and HSD. And while I specialize in hypermobility, I describe myself as an existential therapist, focusing on trauma, grief, and identity while working with people living with chronic health conditions. As a disabled person myself, living with hypermobile EDS and some of the co-occurring conditions, and also as a professional, working with people with all different types of medical diagnoses, I've learned that trauma, grief, and identity are tough to separate from chronic health concerns. And first, chronic health issues often result in medical trauma. But second, chronic pain, illness, they demand that we grieve the life that we thought we would have so we can better embrace what life can be. And this is obviously easier said than done. But today, we'll be talking about how chronic health and complex health conditions impact both our sense of self inside and outside of the doctor's office. Identity can be a sensitive topic, so please take care of yourself. That may look like noticing what emotions come up for you, walking away as you need, taking deep breaths, or regulating. Before we begin, I have no relevant financial disclosures. So, of the thousands of people that I have worked with, one of the most common things I see people grapple with is, who am I now? Many of us define ourselves by our role as a parent, what we do for work, how we spend our time, or our physical abilities. So I often hear things like, I am a mother, a nurse, an athlete, etc. We may also associate our identity with how we look. And while our appearance will inevitably change with time, it can be particularly jarring when that change is unexpected. I've talked to so many people about how changes to weight, hair, teeth can all really mess with our sense of self, which can cause a lot of distress. And these sources of identity make sense. These are things that are important to us and take up a lot of space in our life. The concern is they can sometimes reduce us down to the roles that we have in life. And when something happens to impact that role, like our health changes, that can lead to an identity crisis. It can also leave us feeling like we are just or only our illnesses. And to be clear, I identify as disabled, but I also feel like I am more than just my health. And I'm not here to tell you how to identify, but to hopefully give some tools that might help you in your own identity exploration if that interests you. So, where do we begin? Unfortunately, this is not a one size fits all discussion, and I encourage you to take what's helpful and leave the rest. We're going to cover a lot today and relatively quickly, so it may be helpful to jot down some ideas or questions to revisit later. The goal is for this to be a starting point and hopefully a discussion that you revisit in your own healing journey and maybe even with a psychotherapist or counselor. So, when our health impacts the roles that inform our sense of self, we often experience things like low self esteem, depression, shame, anxiety, or a sense of being lost. Painful emotions are a common experience when we're living with chronic health conditions. So, we'll begin with how to feel. So often my patients tell me, I just want to feel better. But in the words of Dr. Gabor Mate, it's not about feeling better. It's about getting better at feeling. What I mean is, emotions are not good nor bad. It is what we do with them that matters. In fact, emotions are important data, and that information gets missed when we suppress, avoid, or ignore them. So what I'm trying to say is, we're bound to bump into hard emotions like grief. And unless we learn how to dance with that grief, we'll stay stuck within it. As Tiffany Rowe says, we have to feel, to deal, to heal. There are many ways to respond to emotions, but here are just some tips adapted from Tiffany Rowe's work. So first, we need to be able to be okay with feeling things other than happiness and joy. We're not meant to just feel those all the time. And really reflect on what emotions come up for us. We observe the emotions and use things like an emotion wheel, as you can see here, to name the emotions, noticing where it's at in our body, allowing it to exist, and then we ride the wave because for better or for worse, emotions don't last forever. Then we respond with compassion, validation, and curiosity. After we have done a little bit of the emotional inventory, then we can process. And so maybe that looks like thinking critically, reflecting, building more compassion, using spirituality or other forms of therapy to process. We express what we're experiencing. That can look like creating, moving our body, yelling, sharing with someone, laughing or crying. And we cope. We seek that support again. We grieve, which is coping. We learn more about ourselves, our needs, and we take aligned action, which we'll talk about. We regulate, we rest, just to name a few. Now, there's an important caveat. Sometimes we have to compartmentalize to survive, and that is valid. So, getting in touch with our deepest traumas and sadness while driving, let's say, isn't safe. But the same can potentially be said if you're in a relationship with an abusive partner, where you feel like you don't have the tools to be able to do this work safely. So I do want to acknowledge that there is some privilege in being able to do this level of emotional work. And so if you can do the emotional work, the grief work, great. But if not, feel free to skip ahead to the parts of this presentation that feel more accessible to you. Now that we've laid some groundwork, and if you feel up to it, let's talk about the hard question. Who are you? Just noticing what comes up. Does that bring up pain of who you were? Do you find yourself rooting your identity in the role that you have in others' lives? Is there anger that you notice? Or do you feel your brain just go totally offline and shut down? Good news, we're not going to stay here for long and we're not going to have to figure this out today because who we are is a big question and how we engage with that question changes throughout our life. I find it's much easier to get in touch with our values. Values are a core belief about what's important, which helps us guide our behavior and our decisions. And so when we feel lost in who we are or what direction to go in, it can be helpful to connect back to our values, to use as a compass in life to help us connect to those roots and to also find a path forward. We have helpful tools to flesh this out further. These are what we call value sorts, and they can be found through printable worksheets like you see here on the slide, or through online apps, or even cards that you can cut out and organize. It's worth noting that sometimes learning what we don't care about can be just as helpful or powerful as learning about what we do care about. I also encourage doing value work all throughout your life because this also changes and adapts, and that is part of the beauty of living and also healing. So we figure out those actions, and then we take what's called those values, and then we take what's called committed actions that align with the values, the behavior that honors those values to give them new life. And so for a lot of my patients, the identity crisis and emotional distress arises around being a parent. So trigger warning for those that resonate with that. Maybe we don't feel like being a parent is accessible to us because of finances or health. Or maybe we feel like we're not showing up in our children's lives the way that we want to because of our health. We feel and we process that grief when it arises. But it's also helpful to look at the values that go along with being a parent. So for me, that tells me that I care about connection and community, nurturing, mentoring, legacy, joy, and whimsy. And I've been able to honor those values by being a supervisor and a mentor, creating a deep sense of community with friends and chosen family, honoring legacy and nurturing through the work that I do as a therapist, and finding ways to tuck in joy and whimsy into my day-to-day life. Does that make the grief vanish? No, but it can help to give us direction within that grief and a place to connect back to when our identity feels a bit shaken. The other piece that I often see is how our health impacts our sense of worth. Part of this comes from our identity being interrupted, but also because capitalism teaches us that we are worth what we produce. And hinging our worth on what we can offer others or how productive we can be can create a bottomless pit of never feeling like enough. It messes with our relationship with rest, teaching us that rest is bad, which creates difficulties with pacing. We push and we push until there's nothing left in the tank. And then we often end up in a symptom flare afterwards. And that can, one, make us feel more guilty and cause us to want to try and catch up when we feel a little bit better, which exacerbates that cycle of doing and crashing and doing and crashing. Or sometimes our takeaway is that activity is harmful. Our bodies feel too unpredictable or it's too difficult to find balance, and we end up avoiding activity. And that can contribute to deconditioning, which causes more pain, increase in our sense of pain that pulls us away from the things that we enjoy and bring us happiness. And that impacts our mood, which then increases our distress, our depression, and our fear of activity that exacerbates the avoidance and that overall cycle. If you are someone who's struggling with your sense of worth because of productivity or not feeling able to fill that role that informs your sense of self, allow me to pause and say, you are worthy. You are worth more than what you do. Your worth is innate, and it's not connected to your productivity. And it's okay if it's hard to accept that or even sit with that idea. You are not alone in how you're feeling, and you don't have to stay stuck here if you don't want to. This is a great time to invite us to reflect on rest. So, what is your relationship with rest? Explore, challenge, and rebuild as necessary. Remember, rest is one of the hardest skills to build, especially within our current climate and society. Rest is not earned. We have this idea of laziness, but yet researchers have looked all over the world at all different personality traits, and they have never found laziness as a personality trait. Sure, there are definitely difficulties with motivation, there's definitely executive dysfunction, and sometimes there's also what we call an autonomic freeze response, where we become so overwhelmed that we just go offline and we shut down, which we'll talk about a little later. Remember, shame-based change isn't sustainable. You might be able to shame yourself into temporarily getting things done, but it doesn't last long term. Instead, let's get curious about what's going on, make space for it, and then we can better move through it. The last comment that I'll leave you with about rest is my favorite quote by Audre Lorde that says, caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare. Whew. So that was a lot of heavy stuff that I just threw your way, and not a lot of time to sit with it. But I've also promised that we're going to talk about identity within the doctor's office too. Being a patient can make us feel even less than human. During a medical visit, not only is there not time to share all of the pieces that make us who we are, but sometimes we feel specifically like we can't bring in parts of our identity into the room due to fear of being misunderstood, discriminated against, or denied care. And as a result, a lot of the people that I work with talk about having to take a this or that approach to care. And I often hear this the most with my trans, gender expansive, and non-conforming folks who feel like they can either get gender affirming care or care for their HSD or EDS, but not a both and. Some of the things that I frequently hear are, well, if I tell my doctor I have anxiety or trauma, they aren't going to take my health symptoms seriously. If I tell them my pronouns, my sexuality, my ethnicity, my migration status, they might treat me differently or I might be endangered. If I tell them I have EDS or HSD, my provider may not want to work with me anymore and might deny me treatment or services. I recently was working with someone who was seeking a gender affirming top surgery who had to fight through substantial discrimination due to being fat. During their process, they got diagnosed with hEDS after their surgery was already confirmed, and they were terrified about telling their surgeon due to fear that the surgeon would cancel the surgery. And so I met with this person. We processed through their concerns. We identified the surgical risks and ways that outcomes could be improved if their surgeon knew about their EDS. And with the patient's blessing, I wrote a letter of support to the surgeon, providing this nuanced information about EDS and surgery and emphasizing that canceling the surgery would cause a substantial amount of psychological harm. And I'm happy to say that person had a successful surgery and is now on the other side of it. Unfortunately, these are real concerns for us as patients. That's valid. And I don't have a perfect fix, but I do have maybe a few recommendations that might be helpful, starting with asking yourself, can this person really honor my lived experience? What information would we need to know to be able to determine if that person could honor and keep that information safe? The next question is, what keeps me, what keeps you the safest? These are complicated times that we're living in, and safety is top priority. I also recommend finding a medical or mental health professional that you feel safest with and discussing your concerns and your options with them. Sometimes we can vouch for colleagues that we work with, be a buffer or an advocate within the system, or just another data point. I write tons of letters to medical providers saying that no, my patients aren't having psychosomatic symptoms and that the reactions to health stressors are appropriate. It's unfair that providers respect and listen to other providers, sometimes more than their patients. But sometimes we can also use that to our advantage when we have someone that we're safe that we're working with. And speaking of safe people, it might be helpful to bring someone safe to your appointments. Sometimes just having another party present can make us feel more comfortable, but it can also sometimes change the medical experience itself. If you have someone who's safe to bring with you to the appointment, but not into the appointment room, you can always ask them to sit and wait in the lobby as well. I know that has helped me stay calm in numerous situations. The other piece that I really want to emphasize today is that we all have stress responses. They're a part of survival and they activate when our body or our brain detects danger. The four stress responses are fight, flight, freeze, and fawn. Some argue there's a fifth called flop, but I just lump that in with the freeze response. We have capacity to experience all four of the stress responses, but we usually tend to one or two of them and often have very specific tendencies within medical settings. These stress responses become especially important when we have medical or other trauma, as this can increase our awareness of or sensitivity towards danger that keeps us in the stress response even when it's not helpful. So it's important to know what type of stress responses we tend towards so we can best plan for and mitigate them when they become unhelpful. So I'll run through them quickly. Fight has a lot of anger and irritation, as it sounds. This can result in us feeling especially defensive or reactive during appointments. And flight is much more anxiety focused. Maybe there's racing thoughts that make it hard to concentrate or your mind goes blank. Maybe you're like me and you end up talking so quickly that it becomes hard to understand. This is a great reason to prepare and write things down. There's also the freeze response that I mentioned earlier, which has a more depressive dissociative element. Maybe we just check out of the appointment entirely. I've had lots of people tell me that they struggle to remember what's being said because they just shut down and disassociate to protect themselves. This might also show up as feeling numb or really ambivalent, struggling to make decisions, and then, for those of us with more chronic exposure to stressors, we can have what's called the fawn trauma response, which is the least known of the four. That can often show up as people pleasing. This might look like being really focused on being a good patient or getting the provider to like you, sometimes to the point that you don't even realize that you didn't like the doctor until you've left the appointment. Or maybe you agree to things in the moment, and then when you leave, you realize those actually aren't good ideas or you didn't get your needs met. There might be difficulties holding providers accountable when there's harm being done, etc. So we build awareness of the responses so we can try to balance them out, regulating before the appointment and during to try to keep our good critical thinking skills online and help us to stay out of an unnecessary survival response. Preparing for the appointments, though, we have backup in case we do get stuck in one of those responses. And this can look like calling ahead to find out how much time you actually have within the appointment, focusing on top priority concerns, sharing your game plan with the provider at the start of session, and asking for a follow up to target other concerns. For example, saying something like, I'm here today for a referral to a mast cell knowledgeable allergist, but if we have time, I would also like to discuss a knee pain or schedule a follow up appointment to discuss that further. And then afterwards, we regulate. We regulate, we regulate. I cannot emphasize the importance enough of having a toolkit of coping skills that help our body feel safe, because that's also going to help us with processing, but also afterwards to be able to get out of that stuck response if we do find ourselves there in the appointment. So getting to a safe space, feeling the emotions, processing, being mindful of negative talk that may arise or past trauma that may get triggered from the appointment, or just even being around a health medical environment. Remember, you're more than just a patient. Be gentle with yourself and reconnect with the things that matter. Go back to those values, go back to the actions that remind you of the other parts of yourself. Thank you so much for coming today. We're so glad you're here. Remember, I'm Dr. Mars, and I'm always in your corner. Be well.